A World Health Organization official on Wednesday described the dire conditions in the Gaza Strip's remaining hospitals, where patients are waiting to die due to extreme shortages of staff and supplies.
WHO Emergency Medical Team Coordinator Sean Casey, who just returned from a 5-week deployment to the war-torn Strip, told reporters at a press conference in New York that the most critical need is really a ceasefire, because everything short of that is simply addressing needs on a day-by-day basis. During his deployment, Casey visited 6 medical facilities out of 16 that are still functioning and 36 that were operational before the war.
Basically, the whole hospital was filled with displaced persons, thousands of them, reportedly tens of thousands of them, living in the operating theaters, living in the corridors, living in the stairs. And the emergency department, seeing hundreds of patients a day, mostly trauma, with only a handful, literally 5 or 6 doctors or nurses to care for all of those people. Patients on the floor, so many that you could barely move without stepping on somebody's hands or feet. In Al-Ahli Hospital, also in the north, I saw patients who were lying on church pews, basically waiting to die, in a hospital that had no fuel, no power, no water, very little in the way of medical supplies, and only a handful of staff remaining to take care of them.
Since the last round of conflict between Israeli forces and Hamas erupted in Gaza on October the 7th last year, more than 24,400 people have died in Gaza so far, with over 61,500 others injured, according to data released by health authorities in the enclave on Wednesday.